Welcome to this educational video on Wilson's disease, a rare genetic disorder that affects how your body processes copper. We'll explore the intricacies of this condition, from its causes to its management, providing you with a comprehensive understanding of Wilson's disease. Wilson's disease is primarily caused by mutations in the AP7B gene. This gene provides instructions for making a protein that helps transport copper out of the liver and into bile for elimination from the body. When the ATP7B gene is mutated, this protein malfunctions, leading to a buildup of copper within the liver, brain, and other vital organs. It is an autosomal recessive disorder, meaning an individual must inherit two copies of the mutated gene, one from each parent, to develop the disease. The pathophysiology of Wilson's disease is centered around copper accumulation. In a healthy individual, the liver processes copper and excretes excess amounts through bile. However, in Wilson's disease, the faulty AT7B protein impairs this process. Copper then accumulates in the liver, causing inflammation and eventual liver damage, including cirrhosis. As the liver becomes overwhelmed, copper spills over into the bloodstream and deposits in other organs, most notably the brain. Copper accumulation in the brain can damage the basal ganglia, which are involved in motor control, resulting in neurological and psychiatric symptoms. Other organs affected include the kidneys, corneas, and heart. Wilson's disease is a relatively rare condition, estimated to affect about 1 in 30,000 people worldwide. While it can occur in any population, certain ethnic groups, such as those from Eastern Europe, Southern Italy, and Japan, may have a higher prevalence. The disease is usually diagnosed between the ages of 5 and 35, although it can occur at any age. The signs and symptoms of Wilson's disease are highly variable and depend on which organs are most affected by copper accumulation. Liver involvement can manifest as jaundice, fatigue, abdominal pain, swelling in the legs and abdomen, and easy bruising. Neurological symptoms can include tremors, muscle stiffness, difficulty with speech and swallowing, impaired coordination, and changes in personality. A distinctive sign of Wilson's disease is the presence of Kayser-Fleischer rings, which are brownish or greenish rings around the cornea of the eye, caused by copper deposits. Psychiatric symptoms may also be present, such as depression, anxiety, and behavioral changes. Diagnosing Wilson's disease can be challenging due to its variable presentation. Diagnosis typically involves a combination of tests. Blood tests are used to measure ceruloplasmin levels, a protein that carries copper in the blood, which are often low in individuals with Wilson's disease. Blood tests also assess liver function and copper levels. A urine test is performed to measure copper excretion in the urine over a 24-hour period, which is often elevated. A slit lamp eye examination is essential to detect Kayser-Fleischer rings. Liver biopsy may be performed to assess copper levels in the liver tissue and the extent of liver damage. Genetic testing can confirm the diagnosis by identifying mutations in the ATP7B gene. While Wilson's disease doesn't have distinct subtypes, the presentation can be broadly categorized based on the primary organ system affected. Some individuals may primarily exhibit liver-related symptoms, while others may primarily have neurological or psychiatric manifestations. The age of onset can also influence the presentation of the disease. The primary goal of treatment for Wilson's disease is to remove excess copper from the body and prevent its reaccumulation. Treatment typically involves lifelong medication. Chelating agents such as penicillamine and trientine bind to copper and promote its excretion in the urine. Zinc acetate interferes with copper absorption in the intestines. In severe cases of liver failure, a liver transplant may be necessary. Dietary modifications, such as limiting copper-rich foods like shellfish, liver, and nuts, are also important. Regular monitoring of liver function and copper levels is essential to ensure treatment effectiveness. Unfortunately, there is currently no way to prevent Wilson's disease. However, genetic counseling is recommended for individuals with a family history of the disease. Carrier testing can identify individuals who carry one copy of the mutated ATP7B gene. If both parents are carriers, there is a 20% chance that their child will inherit Wilson's disease. The prognosis for individuals with Wilson's disease is generally good with early diagnosis and treatment. Lifelong medication and adherence to dietary restrictions are crucial for maintaining liver function and preventing neurological complications. However, if left untreated, Wilson's disease can lead to severe liver damage, neurological disability, and even death. Recent research focuses on developing new and more effective chelating agents, gene therapy approaches to correct the ATP7B gene mutation, and improve diagnostic methods for earlier detection of the disease. These advances hold promise for further improving the long-term outcomes for individuals with Wilson's disease.